Hello, everyone. Have you been prescribed blood pressure medication? There's a crucial fact medical professionals emphasize as much as drug therapy. Lifestyle changes alone can effectively manage high blood pressure. A Harvard Medical School study found that for people with pre-hypertension, lifestyle improvements can lower blood pressure by 20-30 mmHg, equivalent to the effect of one blood pressure pill. By the end of the 5 methods I'll share today, you'll be amazed. The 5th one in particular will be unexpectedly surprising. Let's dive in. First, let's talk about salt. Have you only heard to cut out salty foods? The real issue hides where you might not suspect. About 70% of our daily sodium comes from processed foods, ramen, ham, cheese, even bread. The World Health Organization recommends keeping sodium under 2,000 mg daily, but Koreans average 3,400 mg. Here's a practical tip. Instead of sprinkling salt, try lemon or vinegar. Their acidity substitutes saltiness and, with their potassium content, aids sodium excretion. Studies show reducing sodium can drop systolic blood pressure by 4 to 6 mmHg within 2 weeks. Second, exercise. Good news here. You don't need to lift heavy weights or do intense workouts. The American Heart Association reports that 30 minutes of brisk walking daily can lower blood pressure by 4-9 mmHg. Even better, you don't need to do it all at once. 3 10-minute sessions work just as well. An interesting finding, some studies suggest afternoon exercise better regulates nighttime blood pressure, though it varies by individual. It's worth a try. Third, stress management. Do you know how stress affects blood pressure? Stress triggers cortisol and adrenaline, constricting blood vessels and spiking pressure instantly. Good news. Deep breathing can calm elevated blood pressure during stress. Inhale for 4 seconds, exhale for 6, and repeat, calming your sympathetic nervous system and stabilizing pressure. For more impact, try 10 minutes of meditation before bed. A UCLA study found an 8-week meditation group's average blood pressure dropped by 12 mmHg, a significant result. Fourth, sleep. This is critical. Did you think only lack of sleep raises blood pressure? It's actually sleep quality that matters. A decade-long Harvard study showed people sleeping less than 5 hours nightly had a 32% higher hypertension risk, and those over 9 hours, 23% higher. A key point, sleep apnea is a major hypertension cause. If you snore heavily or wake often, get it checked. Boost sleep quality by cutting smartphone use 2 hours before. Bed blue light suppresses melatonin, hindering deep sleep. Try reading or listening to classical music instead. Fifth, and this will surprise you, laughter. Thinking, can laughter really lower blood pressure? It's science-backed. A Japanese study found that watching a comedy show dropped participants' blood pressure by an average of 7 mmHg, thanks to endorphin and serotonin relaxing blood vessels. Even more intriguing, laughter yoga forced laughter exercises from India reduces stress and aids vascular relaxation by lowering stress hormones. Why not try all 5? The American Heart Association says these lifestyle changes can return many pre-hypertensive individuals to normal blood pressure. But a critical note, if you're on blood pressure meds, never stop them abruptly. Consult your doctor for gradual adjustments, especially if you have moderate or severe hypertension requiring medical treatment. One more tip, enhance these methods with potassium-rich foods, bananas, spinach, avocados, potatoes. Potassium helps excrete sodium and relaxes blood vessels. If you have kidney issues, consult a doctor about potassium intake. If this helped, please hit like and subscribe. Share your blood pressure management experiences in the comments to inspire others. Thanks for watching, and I wish you all good health.